maternity. Welcome everyone. This is the second day of our event on maternities in pre-modern society. We're delighted to have here today Dr. Eileen Murphy. Dr. Murphy is a professor of archaeology in Queen's University, Belfast. She's particularly interested in the use of approaches from bioarchaeology and funerary archaeology to help further understanding of the lived experience of people in the past. She's also the founding editor of Childhood in the Past, the Journal for Interdisciplinary Society for the Study of Childhood in the Past. And her recent books include co-editorship of Across the Generations, the Old and the Young in the Past, Societies from 2018 with Greta Lillehammer, and also Normative, Atypical or Deviant, Interpreting Prehistoric and Protohistoric Child Burial Practice, which is a very fresh book from 2023 with Melly Leroy. I hope you enjoy Dr. Murphy talk. Just a small announcement, I'll make it quickly in Portuguese. Se vocês estão aqui e estão inscritos no evento, não esqueçam de assinar a lista de presença que vai ser colocada no chat do YouTube. E se vocês também tiverem questões para a doutora Eileen Murphy, a gente vai traduzir essas questões para ela no final da sua conferência, tá bom? Dr. Murphy, feel free to start whenever you're ready. Thank you.
Okay, thank you very much, Pedro, for that very nice introduction. And thank you to Eileen and Pedro and Clarissa for inviting me to give this talk. So if I can just start presenting now, please, Clarissa. Okay, so hopefully everybody can see my slide and can hear me okay. I've put quite a lot of text in my slides, just in case you're not familiar with the Northern Irish accent. So I'm going to talk about mother-infant death in medieval Ireland, and I'm going to be approaching it from an osteoarchaeological perspective. So the remains of women who died during pregnancy or soon after delivery, they're quite rarely discovered on archaeological sites. So the study that I'm going to talk about reviews evidence from 15 sites across Ireland, and you can see their locations here on the map. And from this review, I found evidence of 30 potential maternal deaths. So maternal deaths are basically individuals who died when they were pregnant or within 42 days of giving birth. So I wanted to see what we could learn about these women and their babies, and, you know, also look at potential evidence for social attitudes that were shown towards them. So there's quite a broad date range. They range from AD 350 to 1700. So that crosses the earlier and later medieval periods in Ireland. And they were all pretty much from rescue excavations, you know, usually in advance of roads developments. Now, there is the potential for some cultural differences across these sites, because we generally tend to think that early medieval and later medieval in the west of Ireland would be more Gaelic Irish populations, whereas later medieval populations over in the east may have more evidence of Anglo-Norman influences. But to be honest, I don't think this is a major issue with the approach that I'm taking today. So the types of sites that I dealt with were churchyards, like you can see here at Ballyhanna in County Donegal. So you've just got a little church and then a graveyard around it. And then settlement cemeteries. So you can see a reconstruction of the settlement cemetery of Ranelagh in County Roscommon down here. So people were basically living on a site and they had a burial ground within the sort of the area of the enclosures. And then some of the women also came from monastic enclosures. So in terms of crude rates, like I said, I found 30 women who had evidence of having died, you know, around the time of pregnancy. Now, this was out of nearly 2,000 adult female burials from these sites. So that gives us a prevalence rate of 1.7%. This is quite similar to what has been found for early and later medieval Britain. So for the earlier period in Britain, there's a figure of 1.7%, which is identical. And then for the later medieval period, a figure of 0.3%. So just to put this into perspective, if we look at the situation for modern women, we can use a statistic called the proportion maternal. And this calculates the number of maternal deaths as a proportion of the total number of deaths of women of childbearing age in a given time period. So today, the highest proportion maternal would be in sub-Saharan Africa, and the figure is a staggering 18.2%, whereas in modern Europe, the figure is just 0.5%. So this shows us that there's a real underrepresentation of, pregnant women or newly birthed women in our archaeological sites. Just to emphasize this, this graph just shows you the profile of children from Ballyhanna and in County Roscommon. So there's quite a small proportion of, preterm babies and full-term neonates, compared to the other children, only 47. So we would expect a much higher number of the very young because they were most at risk of death. So there's something going on that is making, pregnant women potentially archaeologically, invisible or with very low visibility, and also very young infants. Now, in terms of preservation, we do get excellent preservation of young babies. So just like you can see the two examples from Ranelagh. So I don't think this fully accounts for the explanation. In terms of women, I think there is the potential maybe that post-mortem cesarean was being undertaken. And we have, evidence of this in historical sources from throughout Europe, and also some potential evidence for medieval Ireland. So this would mean then that a woman and, her in utero baby were being separated, and we wouldn't necessarily be recognizing them in the archaeological record. And also, even within the maternal death category, the baby and the mother might have died, at slightly different times. And again, then they could be potentially separated in the burial ground. So these are some of the sort of the problems and why, our maternal death victims may not be as easily identified in the archaeological record. So just a little bit about osteological methods. So we use pretty much anyone whose report I was looking at, they would have used, the standard adult age and sex determination methods. And we would have used, the same sort of standard techniques for aging fetal and full-term neonates. In terms of how I talk about the infants, and the age categories, preterm babies are those who were less than 37 gestational weeks, and those are the little babies who probably wouldn't have been well enough developed to have had a chance of survival in the past. Full term are 37 to 42 gestational weeks, and then the neonatal are those who were born, so from about birth to about 28 days, so kind of the first month of life. So in terms of the adults, what did I find from their age of death profile? So we were able to look at this for 24 individuals because 6 could only be aged to adult. We couldn't get it any more specific than that. You can see there's a major peak at 18 to 35 years, and then a few individuals in the older age category of 35 to 50. So I was quite surprised that there was no evidence for very young mothers, because we do have some historical accounts, usually from English settlers, who talk about the Irish being, women at 13 and old wives at 30. So they kind of are hinting that Irish girls matured earlier than English. But to be honest, this is really within a kind of a genre in which the settlers were sort of being elevated amongst the Irish, who were being seen as barbaric relatively. So I don't think that's particularly reliable. We do have evidence for fosterage practices in medieval Ireland, from the Irish law tracts. Now, some of these suggest that fosterage ended at the age of 14 and then others at the age of 17. And after this time, a girl would have been eligible for marriage. So, that made me think we could potentially find some adolescents who had died during pregnancy, but we didn't. And the 2 youngest individuals in the study were a woman from Solar who was 16 to 22. So she was, an older adolescent, but she still fell within the 18 to 35 category. And then this woman who you can see at the bottom from Ranelagh in County Roscommon, and she was aged at 17 to 23. So again, later adolescence, maybe early 20s, but she still fell into the 18 to 35 category. So in a modern study, just again to sort of put this into context, a modern study of 144 countries, it actually did suggest that adolescents aren't substantially at greater risk of maternal death compared to women in their 20s. And really, the risk of maternal death is higher in girls who are aged under 15 years. So this then could potentially suggest that fosterage maybe did end at the higher age of 17, and that, girls weren't getting married and getting pregnant, before the age of sort of 15 or before later adolescence. So I was also interested then in looking for evidence for older mothers, because there was only 3 women who died pregnant or as maternal death, aged between 35 and 50 years. So it was quite surprising not to find a higher number of these individuals, because women in their 30s and 40s were very well represented in the study populations. And again, if we look at what happens in the modern world, a lot of studies have suggested that women who are over 35 years of age are at highest risk of maternal death. But this doesn't necessarily seem to be following through in this archaeological cohort. If we look at the infants then and their age of death profile, we were able to work out the age of death for 31 individuals, because there was one set of twins. So 9 of these were less than 37 weeks gestation, so that classes them as preterm. And then the rest were full term or neonatal. Now, the twins from Ballyhannah, who you can see here, and I'll be talking a little bit more about later on, they were aged at 36 and 37 gestational weeks, but they're both included in the full term category. The youngest individual in the study was a little fetus from Ardree, who was only 16 weeks gestation. So this is very, very, very young and the early stages of the second trimester. So in this graph then, I've plotted the age and gestational weeks for the 31 infants. And you can see there are 2 peaks. So the first is at 29 to 32 weeks. And then the other one is in the final sort of stages of pregnancy, sort of 37 to 40 weeks. So this is both in the third trimester. So this would seem to be the time when there was greatest risk of maternal death. In terms of modern women, most of the maternal deaths happen at the start of the third trimester to the first week postnatal. So this is kind of correlating with what we found archaeologically. And in modern women in developing countries, it's usually, the cause of death would be things like hemorrhage, hypertensive disorders, and eclampsia, infection, obstructed labour, and then sometimes unsafe abortions. And whenever they've looked at a bit more detail at the hemorrhage category, quite often it's due to postpartum bleeding, and sometimes when the uterus doesn't contract down properly after birthing. We know that puerperal pyrexia was a big problem in the 18th and 19th century. So this is probably the same in earlier times, when there was maybe a woman had her baby and then died as a result of an infection, because bacteria had got into her reproductive organs during the sort of birthing process. So it's possible then that the peak in the early third trimester deaths could be related to conditions like placenta previa. So basically this causes a low implanted placenta to peel off because the lower portion of the womb is pulled up during later pregnancy, and it can be accompanied by profuse bleeding. And 2 of the 3 middle-aged women in the study, one from Ardree and one from Ballyhannah, they had died during the early third trimester, and modern studies have suggested that women who are classed as over 35 years are a bit more susceptible to pregnancy complications, like placenta previa. So perhaps that could be what caused their deaths at this time. Okay, so it's actually very difficult to try to reconstruct the circumstances of death. And the reasons for this would be due to poor preservation. Quite often the in utero baby is not well recorded or recovered. So it's difficult to actually work out the precise position of the infant remains in relation to those of the adult female. But I had a stab at this, and I concluded that probably 80% of the women had died when they were still pregnant or during childbirth. So this, and then the other 6 probably died shortly after delivery. So the way we can sort of delve into this a bit deeper is to use techniques from archaeothanatology to help us understand what is going on, in terms of the position of the bones of the skeleton, within the burial environment. So that's what I did. So just a little bit about archaeothanatology. Basically, it's a method that's been, greatly developed in France, particularly by scholars like Henri Daudet, and it involves, understanding the decomposition processes and how they affect the position of the body in a burial. So if an individual is buried in a coffin, that's a void. So the bones are distributed differently to a skeleton that decomposes in space full of earth. And most of the individuals in medieval Ireland would have been buried, in earthen graves. So in an earthen grave, the body is surrounded by soil during decomposition. So what we get is a sort of a gradual and constant filling in of spaces, as opposed to, the body just being in a big open space inside a coffin. Oops. So just to flag up a couple of the points. So this is an individual buried in an earthen grave. So we can see features like the lowering of the mandible. The 2 clavicles are very angled. So that suggests, sort of compression. The ribs are angulated, again, suggesting compression. Pubic symphysis is closed. And you can see, the feet are articulated. So there's no real disturbance to the small bones, of the hands and the feet. Okay, so what about archaeothanatology then and pregnancy? Well, like I said, sometimes it can be very difficult to determine the direct relationship between a mother and her unborn baby, because the detail isn't always recorded, or preservation is such that it's difficult to assess. Sometimes the baby is not recognized and the little bones just get gathered up. So you can just see that here in the bottom picture. So this makes it then difficult to sort of reconstruct the position of the baby, and even to be certain that the baby hadn't been born and then already, just placed on top of the mother. So this is why Mélie Leroy and myself, we decided we were going to try to develop an archaeothanatological toolkit, to help people identify pregnant women. And it's something we're still developing, but just here's some of the kind of key features. So in terms of the mothers, the things that you can look out for are expansion of the lower ribs. So if you look in these 2 individuals, the ribs kind of go quite straight, the upper ribs, and then they kind of flare out at the bottom. You can see it very clearly in the bottom individual as well. And that's basically just to, enable the baby to grow as the abdomen expands. You also get, so this is even within an earthen grave, you would get opening of the pelvic bones, again, due to the sort of the pregnancy and kind of the body getting ready for, birthing the baby. Again, because the mother would be of increased size, you tend to get the arms not positioned tightly against the body, and they tend to be sort of angled away from the body. Now, this can have, different sort of extremes, but you can see quite clearly here that the ribs are quite far away from the arms in the top picture, and in the bottom picture, the right arm is again quite separate from the ribs. So again, it's just the larger body of the mother. Another feature you can see are the hands can sometimes be separated from the wrists. So if I don't know if you can see my arrow, but basically in the top picture at B, you can see there's a big gap between the sort of the forearm bones and the wrists, and then the hand bones. And again, if you think about it, if the woman's hands are on her abdomen and the abdomen decomposes, there's quite a high drop, quite a far drop for the hand bones to fall. So this seems to be another potential sort of telltale sign, because these are features we were seeing repeatedly in individuals that we knew were definitely pregnant. So in terms then of the baby, this is a very well preserved baby, and you can see his little head here and then his little body over here. So if a baby dies in utero, the infant should always display evidence of decomposition within a restricted environment, because basically they're inside the mother's body. So just some of the basic things we might look for are the skull being relatively intact and well preserved, and the bones all together. So you can see that very clearly in this baby. And you may also see what we call a walling effect. So basically kind of like lines, against the fetus's body as it was sort of laid against part of the mother. So you can see that in the back of the little fetus. You can see there's pretty much a straight line. So that's suggestive, just of the baby's body being against, part of its mother. So those are two of the features we can look for. So I tried to use some of these and, then look at what was happening with my my study group. So like I said, death during pregnancy, there seems to have been 17 individuals, and in 14 cases, it was possible, to actually examine their position. So in the majority of these cases, so in 11 of them, they were in a cephalic presentation in preparation for delivery. So the head was down, well down in the pelvic cavity. Two exceptions. So the very young baby from Ardree was in an oblique lie, but because that baby was so small, it could have easily moved around even, after the pair had died. And this is one of the things about the archaeothanatological toolkit. It's going to be more useful for larger full-term babies that are, there's less scope for them to move about inside their mother. Another sort of little premature or little early baby from Portmuck was only 30 to 32 weeks gestation, and they were in a transverse lie. And then one interesting individual from Ballykilmore 1 was 35 to 40 weeks gestation, but the body had been sort of split into two parts, and there was some confusion about how to actually what was going on, and thought that perhaps there was some aspect of coffin birth with this. But what seems to have happened is that there were a lot of burrowing animals in the vicinity of the burial. So I think this is how the body became separated into two parts. It was nothing, to do with human activity or coffin birth. It was just simply animal activity. Here's our very well preserved baby from Mount Gamble, and you can see, because it's so well preserved, we can say that it was in the right occiput transverse position, getting ready to be born. Okay, so then we had a couple of examples of possible death, actually during childbirth. So in two cases, the head was very low in the mother's pelvis. So you can see here's an individual from Ballyhanna, and you can see the little head of the baby, right down deep in the mother's pelvis, so potentially even crowning. So potentially this individual, this mother was in the process of trying to, birth the baby when she died. One individual from Faughard Lower was only 28 to 36 weeks gestation. So perhaps that mother actually went into premature labour, because again, the baby's head is very low in the pelvic canal. So in the modern world, premature birth happens in 5 to 18% of pregnancies, and it can be due to a whole range of different things happening. So there can be infection, there can be defective cellular activity, or the cells can start to prematurely break down. Maternal fetal tolerance may break down. There could be changing hormone levels, and even just things like maternal and physical and mental stress can cause, a premature birth. Another example then of death during delivery came from Ballykilmore 6. So in this case, the actual head of the baby, so this was a full-term baby, actually was extruded through the mother's pelvic inlet. So how do we actually interpret this? So one possibility is that the head was able to kind of exit the mother as a result of coffin birth, and this is a term that's been used quite a lot in relation to, whenever you've got like a partly born child. But it is problematic, and Duncan Sawyers, he's argued quite convincingly how we need to be very careful in our interpretation of coffin birth, because, as I said, a lot of these women would have been buried in earthen graves, so their grave would have been filled with soil, and this could potentially have stopped, any movement of the fetus, out from the mother. So really, coffin births can only convincingly be identified whenever you've got a burial environment that contains voids. Now, perhaps, even if a woman was shrouded, maybe there was a small void between her upper thighs, but at the same time, I'm not entirely convinced. Now, in this particular case, I think what's happened is that the baby got stuck, that there was an obstructed delivery. So if you see where that arrow is, that's the little scapula. And I think the baby has had a shoulder dystocia. So basically, this is what happens when the shoulder gets stuck against the mother's pelvis, and then it's an obstructed delivery. So without some sort of intervention, the baby can't be born. So I think tragically, that's what happened in this case. So interestingly as well with this pair, might be tricky to see it. I've marked it a bit clearer later on, but the mother's hand actually seems to be splayed right open and is positioned lying on the baby's head. Now, maybe it was due to post-mortem movement, but to be honest, I think the fact that her fingers were very, very deliberately sort of splayed apart, I think that's less convincing, and I think her hand was deliberately positioned on top of the baby's head. So shoulder dystocia, it tends to happen with a frequency of 0.2 to 3% of modern births. It's very common in modern diabetic mothers who have large infants, and the proportions of the infant body can sometimes make it, just difficult then for them to be born. So there were also then a couple of examples of potential breech deliveries, which also failed, and the pair ended up dying. So we know even in the modern world that like a vaginal delivery from a breech birth can be, from a breech baby in a breech position can be difficult and result in an obstructed labour, because it can end up rupturing the uterus. And a lot of breech births end up in, emergency cesarean section. And even in the modern world, you can end up with a prolonged labour, and the mother then is more susceptible to hemorrhage or sepsis. So I suppose it's not entirely surprising that we do find some cases in the archaeological record. So over here, you can see an example from Mount Offaly. You can see that there's the mother's pelvic bone, and there's the sort of the chest. So basically the abdomen and the lower limbs lay outside the mother's kind of abdominal area, and the thorax and the head is inside. So the head's not visible in the picture, but it would have lain up on top of the lumbar vertebrae. And we can be certain that this was a genuine positioning, and that the baby was in the process of being born because of the positioning of the mother's pelvic bone. This is another example from Ballykilmore 6. So again, we've got a full-term fetus, and again, it looks like they were partly delivered. So this time, only the fetal head is actually still in utero, and there you can see a little eye socket. And the postcranial remains were described as being in a state of disarray, underneath the maternal pelvis. So because the little cranial bones are all together nicely, and because they're so well preserved, this is suggestive of decomposition within the confines of the womb, as opposed to outside the womb. Okay, so death postpartum then. So like I said, there were 6 burials that looked like they were a probable mother and her newly delivered infant. All of the infants in these cases seem to have been, carefully positioned, lying on the chest of the adult, and they were orientated in the same manner as the adult. So their head was generally on one side of the chest. And this is something we do get quite a lot of double burials in medieval Ireland. And sometimes they can be only of adults, sometimes of children, only of children, or sometimes of an adult and an older child. But it's a very typical layout that you find them both with their heads in the same orientation, usually to the west, and sort of lying on the same axis. So I think that's a reasonable conclusion, but there does have to be a bit of a warning, because we do find some cases of neonates buried with definite adult males. So over to the left of the slide, you can see the skeleton of an adult male from Stacumney in County Dublin. And if you look closely against his left elbow, you can see there's a little infant, so a little baby of 38 weeks gestation. And it looks like this pair were wrapped together inside a shroud. This is an example then, over to the right, of a woman from Ranelagh in County Roscommon. So it's an adult female, and you can see there's a baby lying on top of her. And we just assumed that that was going to be a mother and her infant. So the infant was a little bit older than the ones in this study. He was 1.5 months, and we know it was a he because Lara Cassidy and our Trinity lab undertook DNA analysis. So it's a little boy baby with blonde hair and blue eyes. But what was really interesting was that the woman and the baby weren't related to each other. This was confirmed through DNA. So we do just have to be careful when we're sort of making interpretations about infants and adults and relatedness. So I just wanted to come back to the Ballyhanna twins. So we had a young mother. She was very petite. She was only about 4'9", and she seems to have delivered or birthed twins and then died shortly afterwards. So you can see there's one of the little twin skulls inside the pelvic cavity, and then the little rib cage over to the side, and then up just above, where parallel to the elbow, there's another little rib cage. So basically, they seem to have got through the birthing process, but then died. But what I want you to think about is how these individuals are laid out. The mother, her head has rolled off because she's on a bit of an incline, but you can see that her hand is again sort of open over the top of the lower twin's body, so skeleton 979. So you can see the fingers. So that again looks to me like it was a very deliberate placement. And you can't really see her arm in this photograph, but it was basically curved round so that it was kind of almost like cradling the babies. So I suppose what to me, that burial shows a lot of emotion and kind of poignancy, because whoever laid those three out, presumably it was members of their family, and they deliberately did so in a very careful manner. Just wanted to talk about one individual who was potentially a coffin birth. So this was this little baby here, who was only 30 to 31 weeks gestation, and they were recovered lying between the upper leg bones of an adult woman. So the adult woman, her head was to the west, and she was in a typical sort of Christian burial position, and the baby's head was in the opposite direction. So I think that led to the interpretation that it was a coffin birth. However, again, if you bring in the archaeothanatology and look closely at the baby, you can see that there's very tight bilateral compression of the arm bones, and that the forearm where the arrows pointed was actually tightly positioned against the shoulder. So it had been hyperflexed at the elbow, and then the hand was on the shoulder. So that seems to be very incompatible with a coffin birth, and it really looks like this little baby had been tightly wrapped or shrouded. So whether the baby was between the woman's leg, maybe it was to mimic birth, maybe it was just an accidental positioning, or maybe they were related, but we don't really know. But it just again shows why we have to be very careful when we're thinking about coffin births. So in terms of then of the social attitudes towards mothers, so all but 2 of the pregnant or newly birthed mothers were buried within a communal burial ground. So only 2 of them were treated anyway differently, and these ones were afforded a typical Christian burial, with the head to the west, the body extended and supine. So I did sort of wonder, because we know that there's sort of issues, in sort of our different law tracts, about unbaptized infants and just pregnancy. So I kind of wondered about pregnancies being concealed as a potential explanation for maybe why these pregnant women were able to get into, the communal burial grounds. And the Irish traditional dress could potentially have allowed this, because they would have worn a woolen cloak. Everybody wore a big woolen cloak called a mantle that could have concealed a pregnancy. So it wouldn't have been a difficult thing to do. But one of the problems with this is that 4 of the women possibly also died during birthing, and they were also afforded a Christian burial. So I don't think it would have been possible to conceal, the fact that these women had died, when they were giving birth, because it probably would have been a very long and painful and a bloody process that probably would have had ripple effects around a community, with a lot of trauma for the family and the community. So this led me then to conclude that pregnancy and childbirth wouldn't always have been a cause of exclusion from the medieval Christian community. And in fact, it's only in the minority of cases that this happened. So this is just another example of one of the women who I think died when she was giving birth. So this was the Faughard Lower example, and you can see that the head is partly, coming through between the mother's pubic bones. Okay, so there were 2 individuals who I think we can class as deviant burials. Now, deviant burials does have negative connotations, and generally I prefer the term atypical burial because it's a little bit more neutral. But in these cases, I do think there are signs of negativity, and the deviant classification is appropriate. So in the first example, this is a woman from Ballykilmore 6, and she dated to the 10th century AD, and her unborn baby was aged between 35 and 40 weeks, so around full term. So she was buried in the ditch of the settlement cemetery, and you can see there's the line of the ditch kind of running upwards in the picture, but she's buried at right angles to it. Her head was in a westerly direction, which would be suggestive of a Christian burial, but you can see that the way she's been laid out is very casual in appearance. So you can see that one of her arms is up above her head, the other one's kind of just lying out to the side. Her ribs are very splayed open. So this suggests, that there was open space when she was buried, and it looks quite a casual sort of burial. Now, there were 2 sort of metal stubs at either shoulder, but we don't really know what these are. But I do wonder, are they sort of something that might have been intended to sort of help keep her in her grave? Because we do have examples from places like Poland or elsewhere in the world, where people are kind of confined in their graves. But you can see she's very clearly got a stone lodged in her mouth, and that this was very clearly put in and basically wrenched, the maxilla and the mandible apart. So I think that shows a negative emotion towards this woman, and is suggestive that there was perhaps a degree of fear of her, because the stone can be put in as an apotropaic device, to stop a person kind of coming back and harming the living. Now, interestingly, this woman, she had a condition called scaphocephaly. So basically, she had premature fusion of her frontal bone and the anterior part of her sagittal sutures. So this is a congenital condition. It can be caused by a variety of things, like lack of oxygen, birth, trauma, or metabolic disorders. But interestingly, individuals with the condition are more likely to suffer from developmental delay or maybe learning disabilities, particularly associated with speech or language skills. So maybe that's why the stone was in her mouth. Maybe, the way she spoke was a bit different to other members of society. And they wanted to mark it out. So is her deviant burial due to the fact that she maybe had a condition, maybe had, some sort of mental disability or impairment, or was it because she was pregnant? Now, we've also got another very, very similar example that's been more recently discovered from Ranelagh in County Roscommon. So again, we have a young woman buried in the ditch. So you can see where the red circle is. You can see she's buried in the ditch up there, although she follows the actual line of the ditch. You can see she's similar in date, 10th to sort of 12th century. And it looks like it looks like she was buried when the enclosure D ditch was still open. And again, if you look at her burial, it's very casual in appearance. So her ribs again are very splayed out. You can see her vertebrae are there's lots of gaps between them. So this suggests that she decomposed, or she was buried in an open space on uneven ground. Her head has rolled down slope because of the sort of instability of the ground. Again, her arms are in quite a loose position. And it just has all the sort of trappings of a casual sort of burial. Now, in this case, there was no kind of obvious signs of disease or physical impairment, but we do have to remember that only conditions that are, directly related to the skeleton and that are maybe chronic in nature will be visible in the archaeological record. So maybe the Ranelagh and the Ballykilmore young women were outcasts in their community for some unknown reason. Maybe they did there was perceived social misdemeanors, maybe there were mental health issues, or maybe it's just a simple case that the paternity of their babies wasn't supported by the community. So those are two examples of negative emotion, but I just kind of want to return to positive emotion and affection. So like I said, in the double burial cases, all of those that involved an adult with an infant, both individuals were buried according to Christian norms. So this suggests that there was being clear respect shown towards both the mother and the newborn infant. And I think this kind of positioning on the chest of an adult, is suggestive of affection. It's a very natural position to for an adult to put a young baby. And I think, the fact that an infant body was included within the space of an adult body is again, suggesting protection. And even the fact that we get, males buried, with adults, and we had that example earlier where it looked like the baby was shrouded with an adult. To me, again, this is all positive and suggestion that care was being shown towards the baby. The plan here just shows you an adult male with a baby, and you can see again the sort of chest, the positioning of the baby's head on the chest. I talked about the Ballyhanna woman and her twins and how carefully they were laid out. And here again is the image of the baby whose head had been born with the potential shoulder dystocia. And I just tried to sort of mark the positions of the woman's fingers so that you can see, to me, it looks like it's a deliberate positioning. And you can just imagine, if they've really tried desperately to help this baby be born, that the mother wanted to connect with her baby, just even by touching its head, and then the pair sadly died. So I think we can get a huge amount of sort of poignancy in these burials, and even just the little baby who had been shrouded, the potential, the one that had been described as a coffin birth, the fact that a tiny baby was being shrouded and then put into the ground is again, suggestion of that respect was being shown towards that baby, and it was a recognized member of the society. So just to kind of then wrap up, it is a challenging task to gain a true understanding of pregnancy, childbirth, and the postpartum period for women in medieval Ireland. The archaeological data, it can only take us so far at the moment, can only identify cases of maternal death that involve simultaneous or near simultaneous death of the mother and infants. Although I am hopeful that archaeothanatology might be able to help us to identify women who have recently delivered but been buried separately from their babies. And this is something I have a PhD student with Millie Leroy is going to be looking at. The proportion maternal for medieval Ireland at 1.7% is too low because, we get much higher figures in modern day sub-Saharan Africa, which you would imagine the conditions for medieval women in Ireland would have been even worse. So I think there are a lot of maternal deaths that are invisible archaeologically. The study suggested, that there was a similar range of obstetric complications for the medieval Irish women to modern women. The demographics were interesting because I actually was very surprised that there wasn't more older women represented, given that the age of death profile of the different cemeteries. And I suppose then, one of the things that the study showed was that women and their unborn or newly delivered infants are not typically excluded from medieval Christian burial grounds, but we do get some cases that we can class as deviant burials. And I think just the little signs of poignancy and emotion, gives us an insight that maternal death was a tragedy and that it was largely viewed the same way as it is today, and that the family felt the loss and presumably also the community. So thank you very much for listening. And like I say, thanks again to Eileen and Pedro and Clarissa for inviting me and for helping with the technology. Thank you.
Thank you very much. We will have a section of discussion now. I'm going to keep an eye on the YouTube chat channel in case they post any questions, and I'll be translating them to English for you. In the meantime, if I'm allowed, I would like to ask you a question myself. I really liked your presentation, and in a way, I think it was very lucky that later my presentation is also scheduled for today, later in the day, and it touches many of similar topics. Like the title of it, I used it even as a provocation, was like "Invisible Mothers?" ? And then trying to give a little bit of a survey of the osteological data that we have for the case that I study, which is the East Yorkshire burials from the Iron Age. So we have this idea that also there's not much evidence for women there in terms of mothering and mothering practice, but there's actually like a lot of burials. And I was thinking it was interesting, particularly like the theoretical approach that you gave, using like Henri Dudet work with archaeothanatology. And I'm very interested in looking later to the, what you call it, like the toolkit that you are developing, because some of the things with the expansion of the lower ribs and the opening of the pelvic bones, they are identifiable in this material that I'm working, but I never paid attention that much to the hands that you mentioned, like falling substantially. So I will definitely re-examine the data with new eyes.
Good.
I wanted to ask you a question, and one of them is just like a curiosity question, because I'm not very familiar, even though I knew your project of the Ballyhana research projects and the excavations you've been doing there, but some of the like the Ballykilmore, I think that's how you pronounce it, those were new to me, the Deviant cases. But I was just wondering, the first question is, do we have any burials of just like neonates or babies or infants that are separated from possibly like their mothers or their fathers, like just without an adult, just like the burial of like a kid in those ages? And the second question, and this one I know it might be a little bit more tricky because I know it depends on like a dense laboratory analysis, and sometimes I think you very accurately point out to some of the cautions that we need when we're interpreting those materials, like you mentioned the case of DNA, but I was wondering of a different type of scientific analysis, which is like the isotopic analysis, if there's any kind of like isotopic survey with the medieval Irish material. Because one of the things that I'm very interested in Iron Age Britain is like the breastfeeding practice, and we found out surprisingly that there's a work by Mandy J from Durham on breastfeeding practice in some of the northern British populations, like in Wetland Slack and some burials in the south, like in the Dorset region, and they found out that the period of weaning was very short. Like after 2 to 3 months, the diet of the babies is almost like with the same values of the adults, which shows that probably they were having a very early weaning, and like this was being replaced by some kind of like other milk other than the mother's milk, or like a vegetable cream or something like that. So I was wondering if there's any evidence on that with the Irish material. So it's just those two questions.
Okay. So the first question about babies being buried on their own. So yes, we do get young infants being buried on their own in these communal burial grounds. So I showed the graph for Ballyhana. So there was about 47, young infants. A project I've been working on more recently, and the book is open access. So I put the link in at the end of my PowerPoint if people want to look at the data. So this is the site of Ranelagh in County Roscommon, and almost 1/3 of the individuals were young infants. And again, we had a number of cases of twins, little newborn twins, and there was even one pair of twins that were holding hands. So again, I was very interested in the kind of poignancy and the deliberate nature in which the babies were buried. So I think some cemeteries we get lots of newborn babies. Other cemeteries they're a bit less than we would expect. So there's different things happening. If we come to later post-medieval times, we have a phenomenon in Ireland called children's burial grounds, and this is where unbaptized babies are buried. So basically they're the main demographic. You get some adults who are maybe, socially excluded by the church, but it's predominantly little newborn babies. So then in terms of isotopes, so for Ranelagh, Julia Beaumont did some isotopic work on the babies, and she found that breastfeeding, I think it was mostly sort of ceased after about 6 months, although there were some differences across the infants that she looked at. And when we looked at the little baby skeletons, there were very high levels of scurvy and rickets and even comorbidity. And it seems to me that this is again tied into infant feeding practices. And I think the mothers were very malnourished. And then when they weaned their babies, they weaned them on to maybe diluted animal milk or milk with stuff that wasn't pure animal milk, and that this then potentially, caused this malnutrition in the infants. So so it's an area that we do need to do more work on in an Irish context. But again, hopefully that's something for the future.
Yeah. And it's interesting to see the similarity with like a period that, the Iron Age that I was referring to is like around like the 4th to 3rd century, most of the cases. So it's interesting to see still like a kind of like a similar challenge for those mothers in terms of like breastfeeding and all of that. I don't know if that's the case in Ireland, but in Iron Age Britain, in some of the cemeteries, we see also like the lifestyle of those women. They seem to have a lot of pressure in them, like in terms of like the traumas. They are sometimes compatible with the males of the population, except for violent traumas, which tended to be a little bit more concentrated with men than with women, although we have some exceptions in terms of women. But it seems that they were like stop breastfeeding very early, so they can go back to those agro-pastoral tasks that are very demanding in a certain way. And we see that more in terms of the osteobiographies, if we can call it in that sense. I just saw that Clarissa posted a question here on the chat coming from Eileen, and she said, thanks, Professor Murphy. Are there any evidence in the bodies of mother in childbirth of midwifery intervention trying to help the babies to be born?
No, but I think this is something that my PhD student will hopefully be re-looking at, just to see, because I think if there were like any sort of little cut marks or anything, I don't know if they would necessarily have been recorded. So, because some of these individuals were studied quite a while ago. So I have a PhD student who's going to be looking at archaeothanatology and trying to see if she can identify women who've, recently delivered or have had, this post-mortem cesarean, and try to see if there's any evidence, for this potential intervention. So Eileen, maybe in the future we'll have some information.
Okay, if I might ask just another question, since I think we don't have anyone. I'm still looking at the chat at the same time, multitasking here, so sorry if I'm like looking at all the sides all the same. But are there any? When you're discussing the Bollicle more, you emphasizes that question of the stone in the mouth. This reminded me of a case that I've read on the news not so long ago. I think maybe 5 years ago. I don't remember. In Kiltashin near Lough Key, where they found a man with also like a stone in the mouth. But I was wondering, in terms of like grave goods, is there any in those mother and infant burials any kind of artifact found in any of those graves? Because there's one category of of artifact that seem to be happening, even if it's kind of rare, in prehistoric European burials, is like kind of like a ring that sometimes is found in the area of the pelvis, and people didn't understand it that well. Why we would find things like that? I think one of the best explanations or possibilities to interpret that was actually offered by Katharina Rebay-Salisbury, in which she mentioned that it might be pessaries, like to help, to avoid a kind of like a premature. Yeah. So I was just wondering, is there any kind of like amulets or protective things that were buried with those women, and perhaps?
No. No. I mean, we do get grave goods with some of our medieval Irish, like again at Ranelagh, like, because Christian burials, people tend to say you don't get grave goods, but actually I think you do. And I just think we're not looking closely enough at what the grave goods might be. So in both Ballyhanna and Ranelagh, a lot of people had bits of quartz buried with them, so little white stones, and these were buried with the babies and with the adults alike. So there was nothing special with the pregnant women as such, but I do think it's quite a common thing that people were getting bits of quartz, maybe as a sort of like an amuletic device, put in with them, maybe as a sort of a sign of purity. And we've had an individual at Ballyhanna had a leaf-shaped flint arrowhead in their hand, so that was really interesting, and we have a tradition in Ireland that Marion Dowd has written about recently of folk medicine practices, and you get elf shots, which are, prehistoric flints being reused by people in the 19th century to cure cattle and different things. And I think Marion wrote about one, I can't remember what it was, but I think it was a stone that was passed down in a family that people would have had when they were going to have a baby to protect them. So there are these ideas, but I haven't come across anything in any of the pregnant women's graves that I've looked at.
Mm-hmm. Oh, that's awesome. Thank you. I'm sorry to be bothering you with so many curiosities, but I really found it. Yeah. I think we're right on time. So if Clarissa doesn't post any more questions here, I think we can let her know to start like stopping the transmission and all of that. And I would like to thank everyone who's like in the audience. Don't forget to sign in like the presence sheet for if you're a student and you're listening to us right now, because later that will help you with a certificate of attendance. And again, Dr. Eileen Murphy, thank you very much for accepting the invitation, and hopefully we'll keep in touch and have more projects together later on.
Okay, well, thank you very much. It's been a pleasure. Good luck with the rest of the conference.
Thank you. Clarissa, se você puder.